You're watching Your Health on Tech. I'm your host, Dr. John Whyte, the Chief Medical Officer of WebMD. We spend a lot of time talking about ways to use tech to get healthy, using AI to develop personalized nutrition and fitness plans, smart devices to analyze your sleep. But what else should you be doing? My guest today says you need to make sure you get your daily dose of nature in order to truly maximize your health. Joining me is Dr. Matthew Browning. He's the Associate Professor and Director of the Virtual Reality and Nature Lab at Clemson University. Dr. Browning, thanks for taking time today. It's great to see you.
It's my honor to be here.
Now, I want to start off with having you explain to our viewers what's the relationship between nature and health?
Well, John, nature exposure has been tied to over 100 different health outcomes. These can be reduced risk of many diseases and illnesses, but then also just how you feel on an everyday basis, your mood states, how well you can think, and how active you are being outdoors. And that's explained by many different reasons. One of the most dominant ones that people talk about is we evolved to be outside in nature. We didn't evolve to be in our sterile urban environments. And so we might be emotionally and even chemically bonded to nature. So we're healthier when we're outdoors.
Now, Matt, what do you say to those skeptics who say, you know what, you can talk about nature and health, but I just don't believe it. I don't see it on a day-to-day basis. What's your response to that?
You have to look at the literature, John. This field has exploded in the last 20 years. It's not caught up with air pollution, but it's getting close. And environmental epidemiology looks at how where people are and where they live impacts their health. And now green space is part of that equation. Our team recently conducted an umbrella review, which is reviewing other systematic reviews and meta-analyses. We found 40 reviews on nature and health. And we found robust relationships between nature exposure and reduced risk of cardiovascular and heart disease, all-cause mortality, poor mental health, low physical activity levels, even low birth weight of mothers. So this is a robust relationship, and it continues to grow. And I think that they need to go back to the literature.
Now, Matt, you've been involved with a study that it really is quite interesting that you said if you have access to green space, your consumption of healthcare and your costs are actually lower. What did you find?
We studied over 5 million members of the Kaiser Permanente Northern California system, and we found that people that live in the least green space spend about $400 more each year on health expenditures than people living in greener neighborhoods.
Let's make it very practical for viewers. So you talk about that nature dose that one needs, but what does that mean on a practical level? Does that mean I need to be outside? I need to live in the suburbs versus the city? What exactly are you measuring when you're saying that nature dose?
Well, fortunately, we see beneficial effects in the brain and in the body, even after only a few minutes of being outside in nature. And you're right, John, that begs the question of what is nature? Well, we find that the most beneficial exposures are when you're around biodiverse areas. These can be parks, these can be forests, they can be gardens. They often have trees, they often have different wildlife, and it doesn't have to be a national park or a large urban park. These can be found in vacant lots, in your backyard, and other places.
I'm always fascinated by this forest bath or nature bath. Tell our listeners what that is. Sounds like you're going out and bathing in the forest, but it's not that. What is it?
It's really a term that motivates people to think of nature as a prescription. It came out of East Asia. There was some significant governmental financing in Japan and other areas a couple of decades ago, and that term has now spread across the world. One thing in the United States that people are doing are looking at park prescriptions, where you
Hmm.
actually get a signed note from your physician to go out into a local park. And Nature Dose is a powerful way to objectively track whether you meet that prescription goal.
Does there need to be green space? What if I'm walking in a city around big buildings? Does that count?
It does count in some ways, although being out in a park or a green space is going to provide more benefits. If you're walking along a street and there's no trees, it's going to be hotter, there's going to be more air pollution, and there's going to be noise from the traffic. And those all negatively impact your health.
You're making it easier for all of us. You've helped develop this app called Nature Dose. I've been using it. I've been talking to you about the doses that I've been getting in terms of exposure in nature. Tell us about this app and how people might use it.
It's really an innovative technology, John. It's based off of machine learning and geolocations of your phone and over 30 different data sets that calculate how much nature is around where you are and whether you're inside or outside, again, based off of all those data and what the phone is indicating. For example, is the phone moving and how fast? So it calculates how many minutes you're outside in nature and gives you that weekly dose. And we really think of this as the anti app, though. It's not something that you want to be checking on a regular basis. You do get notified if you meet your goal, and the default is 120 minutes or just 2 hours a week. But other than that, we really want people to get off their phones, have this as a tracker, and motivate people to get outside.
But what do you do, Matt, if you live in an urban environment where you don't have access to a lot of green space or parks? Are you then at a disadvantage in terms of your health?
You might have to prioritize it more in your lives than someone that gets more incidental nature exposure just by where they live. You might have to prioritize going to a park on a daily basis or a few times a week, just like you have to go to the grocery store or go to the health club.
Now, Matt, we often talk about disparities. And what I'm concerned about listening to you is that here we're talking about the relationship between nature, green space, and health. There's a lot of people through no fault of their own, based on where they're born, in terms of the socioeconomic status, they're just not going to have access to green space, or certainly not in an easy way in the short term. So, how do they address the fact that here's something that has benefit and there's challenges with exposure? Are we not talking enough about access to green space?
We are starting to talk more and more about it. And the first step in that is actually identifying where marginalized communities live that don't have access to nature. And there's good research on that. And the Nature Dose app is allowing us to go one step further, identifying where people don't use nature that have access. So there's two components here. We need to provide safe, equitable access, and then we need to make sure we understand also the psychological barriers that prevent people from going outside.
Now, Matt, we always like to be very practical on this show. So, I mentioned at the beginning about we've got apps to analyze our food, we've got devices to analyze our sleep and tell us how well we're sleeping. We're talking about the importance of sleep, the importance of, our mental health. So, when people are trying to manage their day and there's limited time in the day and our phones can only hold so many apps, why should we think about this Nature Dose app?
John, it's because, again, it's an anti app. It's not something you need to check on a regular basis. You don't get notifications, with the exception of when you reach your goals, or once in a while, we might actually provide helpful tips on how to meet your goal. It's something that runs in the background, and you can look over time how you're doing. And I really think that is the next frontier for health apps, something that you can use as a tool rather than something that is using you.
Well, Dr. Matthew Browning, I want to thank you for taking the time today to help explain this evolving research about the relationship between nature and health, and how we can use apps such as the one that you're talking about, Nature Dose, to really help us make it easier to know that we're getting enough nature in our lives. Thanks for taking the time.
My pleasure.